Good morning, everyone. Today I will discuss about the RBC, WBC, and platelets. RBC, red blood cells, formation bone marrow, and death spleen. WBC, white blood cells, leukocyte, formation bone marrow, and death spleen. So today topic blood cell count, including reticulocyte count. So a complete blood count is a fundamental laboratory test that measures the quantity and character of red blood cell, white blood cell, and platelet in the blood. It is widely used for health screening, diagnosis, and monitoring of various medical conditions because it provides detailed information about blood cell production, size, and function. Components of complete blood count. These are RBC. The cell carry oxygen throughout the body. The normal count is 4.2 to 5.4 million per microliter for women and 4.6 and 6.2 million per microliter for men. Low RBC count suggests anemia, while high level may indicate hydration, polycythemia, or other disorder. Hemoglobin, this is the oxygen carry protein. In RBC, normal level are 12 to 16 gram per deciliter for women and 13 to 18 gram per deciliter for men. Hemoglobin can classify anemia and is subject to change with hydration status or lab errors. Third, hematocrit. This measurement reflects the percentage of blood composed of RBC, 36 to 48% for women, 40 to 54% for men. It mirrors hemoglobin trends but is also influenced by plasma volume. Red cell indices, this include MCV, mean cell volume, MCH, mean corpuscular hemoglobin, and MCHC, mean cell hemoglobin concentration, and red cell distribution with RDW. So first, MCV, size of RBC, help classify anemia, microcyte, normocytic या macrocytic. Second, MCH, hemoglobin per RBC 27 से 32 picogram. PG means picogram. That another MCHC, mean cell hemoglobin concentration. Hemoglobin concentration in RBC means red blood cells 32-36 gram per deciliter. And fourth, RDW, red cell distribution width. Variability in RBC size 11.5 say 15%, important of characterizing anemia types. White blood cells. This is prominent for immunity. Normal range is 4,000 11,000 per microliter. Abnormality may indicate infection, inflammation, bone marrow problem, blood cancer. That is known as leukemia. Differential count break down the types of RBC. There are many types of leukocytes in this PPT. Neutrophil 40 to 60%, lymphocyte B से 40%, monocytes 2 से 8%, eosinophil 1 से 4% and basophil 0.5 से 1%. Change help pinpoint infection, allergy या hematologic disease. And third one, platelet. This platelet function means blood clotting. Key for blood clotting range 150,000 से 4 lakh per microliter. Thrombocytopenia low can lead to bleeding. Thrombocytosis high may signal underlying disease या risk of clotting. Indication and clinic use. First of all, diagnosis, monitoring and screening. तो फर्स्ट ऑफ ऑल डायग्नोसिस, तो CBC यानी मीन्स कंप्लीट ब्लड काउंट कैन हेल्प डिटेक्ट एनीमिया, इन्फेक्शन, ल्यूकेमिया एंड मेनी अदर ब्लड डिसऑर्डर. Monitoring, it is routinely used to monitor the effects of medications या illness like chemotherapy, infections या chronic disease. Third, screening, part of routine health exams to detect issue early, especially for patients with symptoms like fatigue, fever या bruising या unusual bleeding. How the test is performed? So blood is drawn from a vein and placed in a tube for automated analysis. Sometimes results prompt further review with a manual blood smear under a microscope for cell morphology and abnormalities. This is a complete blood count normal range, the WBC, and hematocrit, platelets, and RBC, and hemoglobin. These parameter is showing number of percentage of WBC, hematocrit, platelets, RBC, hemoglobin in your blood. This is a reference range for adults. These are test WBC 4000 to 10,000 per microliter, RBC, hemoglobin, hematocrit, MCV, mean cell volume, mean cell MCH, mean cell hemoglobin, MCSC, mean cell hemoglobin concentration, RDW, RDW, platelets, neutrophils, lymphocytes, monocytes, eosinophil, basophil. So these are value of RBC, erythrocytes, leukocytes, platelets, and blood indices. Interpretation and follow-up. Result outside the reference range can indicate numerous conditions from begin to serious. Interpretation considers symptoms and medical history. Occasionally, superior results can occur due to technical or pre-analytical issue. Hence, clinical may repeat test or order a blood smear review if results are unexpected. The CBC remains a pivotal tool in modern medicine for its speed, cost effectiveness, and rich clinical information across a wide range of disease. A reticulocyte count means immature red blood cells is a blood test that measure the number or percentage of reticulocytes which are immature red blood cells produced in the bone marrow and released into the blood stream before becoming mature red blood cell. This test is used to evaluate how well the bone marrow is producing red blood cells and can help diagnose and monitor various conditions affecting red blood cell production such as anemia and bone marrow disorder. This is normal value. This is normal value in healthy adults 0.5% to 2.5%. In infants, the normal range is higher, but those at 6% of all red blood cells. Clinical significance: high reticulocytes count may indicate increased RBC production due to blood loss, hemolytic anemia, recovery from anemia, example after treatment with iron or vitamin B12. Low reticulocyte count may point to bone marrow disinfection conditions where red blood cells production is impaired, such as plastic anemia, chronic kidney disease, nutrient deficiencies like iron B12 and folate. Uses: assess bone marrow function, differentiate between types of anemia, which type of anemia is prominent for body, monitor recovery after treatments for anemia, bone marrow disorder. This is a life cycle of red blood cells. Stem cells convert rubeblast. Rubeblast is convert erythroblast. Erythroblast is convert lead erythroblast, and lead erythroblast is convert normoblast without nucleus, and normoblast is convert to reticulocyte. Reticulocyte is a immature red blood cells. Reticulocyte convert to erythrocyte. Erythrocyte is a RBC. रेटिकुलोसाइट पैरामीटर, एज रेंज, नॉर्मल रेंज, परसेंटेज रेटिकुलोसाइट्स, ये वीक में नॉर्मल रेंज, एब्सोल्यूट रेटिकुलोसाइट्स, इमेच्योर रेटिकुलोसाइट फ्रैक्शन, रेटिकुलोसाइट हीमोग्लोबिन. तो these are value according to age range and normal range. Thank you so much.